Here's 3 hairstyles that is killing your hair. Number 1, braids. I know that's the thing. We like our, our faux locks, our braids, our long braids. It's really killing your hair because some of you guys, you're keeping it in too long. It's just too tight. Tightness, tension can cause alopecia. Number 2, ponytails. Oh, I know it's so cute. The ponytail with the nice wavy bang, but that glue on your scalp and that tight ponytail in the middle, if you ever experienced that little bald spot in the middle, most likely it's coming from pins. It could be coming from rubber bands. It's too tight. It doesn't help with length retention. Last but not least, crochets. When you do your own hair at home, when it comes to like sew-ins, braids, and crochets, I feel like you experience more length retention sometimes compared to going to a salon because you know how tight you want your hair. You know you don't want it too tight. You know how to do it loose. Sometimes when you go to a salon, they don't care about your hair. Some braiders braid too tight.
Things I would never do to my hair as a Black dermatologist. I would never put a weave in my hair and leave it in for over 8 weeks. I know it's expensive to get these put in, but every day in my practice I see people who are devastated by the hair loss, the pain, the scarring that's being left by hair that has been pulled too tightly for too long. Similarly, I would never wear tight hairstyles back to back, like think tight weaves, tight braids, really long locks. You want to give your hair root a break. Another thing I would never do is wear an elastic sleep bonnet. I would prefer a satin-lined bonnet that has a wide band so the elastic doesn't get a chance to twist up around your hair and break it off.
Ladies, beware of tight hairstyles because all that tension will destroy your hair over time. I'm not saying you should never get some of these hairstyles done, but if you have fine hair, understand that you're at a higher risk of losing your edges. So be cautious and make sure to give your hair a break in between styles. Or better yet, avoid these tight hairstyles altogether. Try to leave your edges alone. Stop being obsessed with having your edges snatched. Learn to love your natural hair and your natural beauty. Because after all, you should really be concerned with preserving the integrity of your hair, especially your follicles. Like, do not get me wrong. Once upon a time, I used to love these braids. Oh my gosh, look at this style. It's so pretty, right? But then you gotta think, what happens when I take it down? All your edges are going to be gone. Even this one, I don't even know why this lady would allow the person braiding her hair to go so small because it's a small amount of hair and the braids are super heavy. Now, this video right here, when I saw this on Instagram, I just couldn't believe it. Like, girl, you have to give your hair a break. And this is why I'm also not a fan of weaves with the leave out, because ultimately you will have heat damage. Another example of like braids being super tight, pulling on the edges, right? And this is how it all leads to traction alopecia. It's just not worth it. The styles are super pretty, but if you really want to grow beautiful, healthy, natural hair, I would suggest that you stay away from all this. Ooh, girl, what happened to your hair? Oh my gosh, I would start to freak out. You guys, when you take out your braids or take out your weaves, right? Make sure you properly detangle your hair before you start shampooing your hair. And also, do not go straight into a shampoo. Make sure that you also do a pre-poo treatment before you apply shampoo onto your hair. Now, this lady right here, I don't even know what is wrong with her. Just trying to straight up pull the lace front from her forehead. You're gonna yank out all your edges.
I really hate that this happened to you. This looks like something called traction alopecia. I frequently see this in clinic. So if you ever notice that your hair or your edges look very sparse after a particular hairstyle, whether it be braids, a lace front, a tight ponytail, hurry up and come see a dermatologist. There are some things we can do to help treat this, to help regrow your hair.
Hi everybody, this is Dr. Mia Green, your Jamaican dermatologist, and today we're going to be talking about my favorite topic, alopecia. Alopecia is a medical term for hair loss. You have internal versus external causes, scarring and non-scarring. I'm going to be discussing the external causes of hair loss today. One of the very common ones that we have in Jamaica is traction alopecia. This is where we actually do the hair damage to ourselves by putting in hair that can cause a lot of tension onto our own existing hair, and that causes the hair to pull out over time. Other things that we can do is wear very tight hairstyling by wearing cane rows or cornrows, as we call in other countries, or other hairstyles that actually pull on the hair.
This is why you shouldn't do everything you see on the internet. I was trying to do this hairstyle. I'm going into the workplace with squiggly lines on my head. I saw the girl doing it. I said, this is very nice. Let me also do some. No, I said what? Feels like it's an artistic statement. Like you need to go out with confidence to wear it. And y'all know I just took off my wig and I didn't account for the fact that because the wig ended here, my forehead would be tanned. Please look at this. If you see me walking around town, you gotta say, oh my god, you look so nice.
Hello, I'm Dr. Cornelius, a board certified dermatologist, and I want to highlight why you need to see a board certified dermatologist whenever you are experiencing hair loss. So these two patients appear to be very similar in terms of what their diagnosis may be, but in fact, two different diagnoses. Above me, traction alopecia. To my right, frontal fibrosing alopecia. Frontal fibrosing alopecia is an autoimmune alopecia that can destroy the hair follicles by creating inflammation around the hair follicles. If this inflammation persists, the hair follicle can be permanently scarred as well. Traction alopecia, we focus more on hair care practices, making sure patients are avoiding braids, weaves, sew-ins, anything that applies tension to the area. And we also use anti-inflammatories. However, in frontal fibrosing, we get really aggressive with the anti-inflammatory and sometimes even needing to suppress the immune system to control the inflammation. Remember to always consult with a board certified dermatologist whenever you experience hair loss.
This is frontal fibrosing alopecia and not traction alopecia, not in GIPS, not in G-BABA. It is a variant of lichen planopilaris. It causes permanent damage to the scalp and permanent hair loss. 4 clues you may be suffering with frontal fibrosing alopecia. Number 1 is hair loss along the hairline, sometimes above the ear, extending all the way to the back, thinning of the lateral eyebrow, as well as an uneven skin texture or fine rash or pimples on the temporal area. You may also get pigmentary changes, which you'll see along the side of the face, on the ear, as well as on the neck. The pigmentary changes can occur with the hair loss, before the hair loss, or after the hair loss. Treatment is immediate, it's urgent. Urgently seek the attention of your dermatologist. Dermatologists will help you create a long-term plan to prevent the progression of disease as well as prevent hair loss. Treatment includes multiple therapeutic modalities. Dermatologists may combine oral medication, topical medications, intralesional injections, as well as help and guide you towards choosing proper grooming techniques that will not further cause damage.
Frontal fibrosing alopecia is one of the most common forms of scarring hair loss. Because it is a scarring form of alopecia, once the hairs are scarred and lost, they will never come back. And so as a doctor, I hate stripping my patients of hope, but I find it unethical to give my patients unrealistic expectations when I know very well that the train has already left the station. As the name implies, it's a hair loss that involves the frontal scalp, and it also commonly involves the eyebrows as well. There are some meds that help prevent the progression, but at a certain point, the hairs never come back, and so the only successful treatment is surgically with a hair transplant. For hair transplant, the donor site needs to have similar characteristics to the receiving site. For example, hair loss in the frontal scalp, we take hair from the back of the scalp. But for hair loss in the eyebrows, we can't take hair from the scalp. That would block their vision. The best match is actually pubic hair. You may find that to be repulsive, but we never said medicine was pretty.
Trichorexis nodosa is a rare hair condition characterized by weak points along the hair shaft, leading to breakage and hair loss. These weak points result in the formation of small nodules or nodes along the affected hairs. Trichorexis nodosa can be caused by a variety of factors, including genetic predisposition, excessive heat styling, chemical treatments, and certain medical conditions. At times, a trichologist will examine the hair shaft under a microscope, where these nodes can be closely observed.
Look at this. The problem is this. Look at this. Literally, these white dots you see are my literal hair follicles from my scalp. Like, who knows how thin my edges really are because I'm losing hairs. And I'll sometimes just pick them out. I don't know. Just know, on the sides, it's the worst. And it's because I always take these pieces and I tie back all of my braids with them because I don't like how they look down in my face. And I miss my curls. So we're taking them out right now.
Talk about one of the most common hair shaft disorders, which is called trichorexis nodosa. We see this the most, and that is when there is a white nodule along the hair shaft. You can feel that white nodule because it'll be a little bit more rough, a little brittle than the rest of your hair. And that area where you feel that nodule is more susceptible to breakage, meaning that it'll break off easier, and it can make it seem like your hair is not growing or your hair won't grow past a certain length. Now, it's either acquired or inherited. Inherited meaning from 6 months to a year, you will start to develop those nodules. Acquired means the way that we actually handle our hair. So chemical stress, relaxers, bleaching, excessive heat, styling, rough combing and brushing, the way that we handle our hair. So that's why I always say, be kind and be gentle with your hair.
Hey guys, I'm here to show you the progress of my edges after the knotless braids. I had shared with you guys like a month ago that my hairline was gone. I'll like put a picture over here so that you guys can see like how bad it was. 1 month later, as you can see, the hairline has grown. I didn't have hair, like all this just grew. Same to this. That's why I have this on my hand, because I was trying to brush.
Take care of your hair and always be mindful of the styles you choose. Thanks for tuning in, and don't forget to follow and subscribe for more helpful tips and advice on how to take care of your beautiful hair. Until next time, stay fabulous with a head full of hair and your edges intact. I'll be checking. I know you live, girl. I do. See you next time, you guys. Love y'all. Peace.